Over 1 million South Carolinians live with a disability. For 12 years, the South Carolina Access and Independence Network has gathered people with disabilities to share what they need to thrive. They work with lawmakers to remove barriers and create practical solutions. Today, lawmakers can address our real-world needs and ensure every South Carolinian has the opportunity to live independently and contribute to a stronger state. Our lawmakers hold the keys to continuing the work to unlock barriers that stand between disabled South Carolinians and true self-sufficiency. Disabled South Carolinians want access to employment, transportation, housing, and health care, the pillars of community living that provide us the freedom to confidently contribute to our communities and the resilience to realize our full potential. Thousands of capable South Carolinians with disabilities are ready and willing to work, but they remain sidelined. Our state ranks among the highest in the nation for unemployment among people with disabilities. In South Carolina, people with disabilities are 2 times as likely to have unemployment or job loss. People with disabilities have talent and skill, but our systems are not aligned to support us. Transportation is the backbone of independence, productivity, and economic growth. Yet South Carolinians with disabilities are 2 times as likely to lack reliable transportation options, particularly in our rural communities. Without accessible and reliable transportation, people cannot work, they cannot attend medical appointments, and they cannot participate in community life or the local economy. Affordable, accessible housing allows us to participate in community life, maintain employment, build financial stability, and contribute productively to our families and local economies. Without affordable, accessible housing, people with disabilities are removed from the local economy, face institutionalization, and even homelessness. The cost difference is clear. Nursing home care costs over 2 times as much as home and community-based services. In South Carolina, nursing home care now exceeds $110,000 annually, while home and community-based services cost around $45,000. Despite this significant financial incentive to fund and support community living, over 41,000 people remain on wait lists for home and community-based services, and more than 45,000 live in costly institutions. Medicaid provides a health care lifeline for long-term services and supports that allow people with disabilities to live and work in their communities instead of segregated institutions that are restrictive and costly to taxpayers. Medicaid is a lifeline for so many South Carolinians with disabilities, but it remains a severely underfunded program. In South Carolina, the funding need is more urgent than ever. We need funding to handle rising costs and enrollment and pay providers at rates that help them stay in business. When home and community-based services are underfunded, families leave the workforce to provide care due to lack of support, impacting the state's economy. Disabled people are pushed into restrictive institutional care, and taxpayer costs increase long-term. Community living that fosters economic participation and self-sufficiency does not depend on a single program or policy. It depends on employment, transportation, housing, and healthcare working together as a coordinated system. When one of these elements breaks down, independence begins to unravel. A person cannot maintain housing without income. They cannot earn income without employment. They cannot keep a job without reliable transportation, and cannot sustain any of it without access to healthcare and long-term supports. These systems are deeply connected, and if we want South Carolinians with disabilities to live independently, earn income, and participate self-sufficiently in their communities, we must strengthen all 4 together. Now is the time for lawmakers to move beyond discussion and take decisive action that strengthens self-sufficiency and turns these commitments into real, tangible outcomes for South Carolinians with disabilities.